Hello, my name is Dr. Julian Barwell, and I'm a consultant in clinical genetics at the Leicester Royal Infirmary. In this, the second of three videos regarding the launch of the Genomic Medicine Service, we'll be talking about the consent conversation we have with patients. Genetic or genomic testing can help patients understand the cause of disease, what does it mean for them, but also what are the wider implications for their family. However, we don't always find a clear mutation or pathogenic variant when we carry out a genetic or genomic test. The significance of what we find may be unclear, and also, even if we find nothing, this does not necessarily exclude there being a genetic or inherited component to their condition. It's important that patients are aware that the result may still provide uncertainty as to the cause of their condition and their risks for their relatives. Also important that patients are aware that their DNA will be stored and be linked to their clinical records. Patients often ask detailed questions regarding confidentiality and data storage. And if your patient does have additional concerns, please don't hesitate to contact us in the clinical genetics department. Whole genome sequencing can occasionally find variants or changes in the genome which may have significance for the patient's health, which is completely different from the indication for the original test. For instance, the patient may have a cardiomyopathy, but actually we end up identifying that they are at risk of breast cancer as there is a mutation or a loss of a breast cancer susceptibility gene. It's important that patients are aware that if they're undergoing these types of whole genome sequence type tests, that there is a possibility of identifying these incidental findings. In time, we hope to be able to understand more regarding the inherited nature of these types of conditions, but it will take time, and the information that we give to patients may vary as we end up having increasing access to databases and functional assays and computer modeling. Therefore, it is important that we tell patients that we may come back and provide further information about what we find in the future. If we identify a change in a gene, it's important that you refer the patient onto clinical genetics so that their relatives can also have the opportunity to go through a predictive genetic test with one of our genetic counsellors. Also, if there is a wider significant family history or other clinical features which make you feel it's extremely likely that disease is inherited, we would still urge you to make a referral to clinical genetics even if we don't find a gene change. I do hope this video has been helpful. Please do not hesitate to contact either me or one of my colleagues in clinical genetics if you have any further queries. There'll be more information at the end of this video, but goodbye for now, and thank you for listening.